Hi, and welcome to the Soul and Survival podcast with Grant and Louise Bentley. We have run the Victorian College of Classical Homeopathy since 1995. We are both qualified practicing homeopaths, and Grant is also a naturopath. Together, we discovered a link between energy and facial structure based on traditional ideas from homeopathy that have roots going back 200 years. This project is called Homeopathic Facial Analysis, or HFA for short, and has been the cornerstone of clinical diagnosis and training courses since 1999. Between us, we have written and produced 7 HFA books, including Soul and Survival. Soul and Survival is the philosophy of energy influencing matter and how this energy forms individual facial structure, our unconscious drives and fears, our life patterns, and universal time cycles.
Well, hi everybody. Welcome to the next Soul and Survival podcast. Welcome, Louise.
Hi Grant, how are you?
Good. Okay. What were we doing again?
Well, you ended up on the last one talking about, you'd given quite a bit of focus on first aid, remedies, acute, as in not just the remedy. You were trying to point out that it's the situation, and many remedies can cover those situations. But some remedies are really famous for the lock and key, like arnica with the accidents, apis with the stings, cantharis and arsenicum with some, low-level burns, that type of thing. But we did end up mentioning that, there is a point where you can find a good chronic remedy and also use it for an acute. And we also discussed the daily dosing and why that's so important. And I know you've mentioned it before, but we really do get questioned and quizzed on this quite a lot. So it seems worthwhile to repeat all about how you think chronic case management can be, or how it can go and what outcomes you can get, and also how rapid dosing is appropriate for acute phases of the chronic illness or even a specific acute in its own right. So there's a lot there.
When you're dealing with acutes, there's a very predictable set of signs and symptoms. That's how you know the diagnosis. Well, it's how you used to know. I mean, a lot of doctors now don't know anything until the blood tests come in and tell them. But if you're talking about older doctors that are very used to being able to look at the symptoms that people present, then they could tell a case of measles, with one eye, really. I mean, they know it straight away. They could see scarlet fever straight away. They could see chicken pox straight away. They know exactly what it is. They didn't need a blood test to tell them what it was. And the reason that they could do that is because there is a similarity of symptoms, right? So that becomes really important because that similarity shows you that it's the actual virus or bacterial infection itself that is imprinting itself onto you. Otherwise, there wouldn't be that similarity. So it's coming from the actual disease. Now what we do when we do a sum total of those symptoms, which are going to be 80% disease symptoms, but nonetheless, you don't put down sort of spots, or anything. You're trying to get something a little more unique, but often you can't find it. So that's all you've got left. So essentially what happens, particularly when you're dealing with kids, they're not giving you any modalities or anything. So what you're doing is that you'll end up with doing a repertorization that gives you remedies that are almost specific for that disease. Now, that had been done a long time ago, and it had been done successfully, and it had been done repeatedly successfully. That's why we have what we call genus epidemicus remedies, meaning that, say, if we stick with, now I think last week we were talking about belladonna a lot because we were talking about it in an acute framework as the acute of Calcart.
Well, to be fair, it should be mentioned that that was written, but it's not something that is directly seen as a direct relationship. Would you say that to be?
Oh no,
is that fair?
I know. No, I definitely know practitioners that work that way.
Yeah, okay.
Definitely, I do.
But you're saying that you don't.
No, I don't.
Yeah.
No,
Okay.
I
well,
don't.
that's the point I'm making.
Yeah,
Yeah.
no, I don't work that way. No, no, I don't. I don't like. No, I just don't.
But yeah, I mean, it's important to say why. Like, I know why, but
well, in order to, well, no, because I'm not going to say it just yet, because what that does is that it switches the direction of what we're talking about into something completely different,
Okay.
because it's really complex. But I'll get into it. So just make a mental note. I will get into it, because we'll talk about that chronic or constitutional stuff. Now, for absolute newbies, when we talk about chronic or we talk about constitutional treatment, you need to understand that they are interchangeable terms that mean exactly the same thing. The same with traditionally, when you read about classical homeopathy, that is chronic or constitutional treatment. So, anyway, back to, say, the belladonna, for example. Belladonna is almost as specific for conditions like scarlet fever, because when they did the proving of belladonna, they created high fevers, dilated pupils. It created delirium with the fevers, thrashing about, and a restlessness with the fever, and so on. It also created the heat of the body, even if it was accompanied with an internal chill. So you can see that when you're dealing with a disease like scarlet fever, the impact or the vibration of whatever is the scarlet fever virus, which is a morbillivirus, I think. I'd have to go back to my pathology, but I'm pretty sure it is. Same as measles. Measles is a morbillivirus.
I know measles is. I'm not.
Have
familiar.
I got it wrong?
I'm not-
No. It's
I'm
a
not
strep
familiar.
infection. No, it's
Yeah.
a strep infection.
Yeah,
Of
okay.
course. What the hell am I talking about? It's a strep infection. Anyway, so all right. So you have all of the symptoms of the strep create a set of signs and symptoms in that person that the proving of belladonna did. So belladonna becomes what we call a specific or a genus epidemicus remedy for scarlet fever, meaning that they're so closely entwined with the symptoms created by the virus and symptoms created by the proving that they're a glove over the hand. Meaning now, if we go in, now we have to use our imagination, because the only way that something that can create such a similar disturbance in the body as, say, belladonna and scarlet fever is because they both have a roughly similar resonance or energy. Now we go back to last week when we were talking about the magnets, and the two poles of the magnets will repel each other. Now we have two similar energies again in the same body. One is going to repel the other one. So now what we do is we make our remedy, or we try to make our remedy either more frequent, we're going to make it stronger than the strep virus in this case, right? So how we're going to do that is either by frequency of repetition, just hit it every 5 minutes sometimes if it's really severe, or we're going to do it with potency. I do it generally with frequency, but you don't have to. You can do it with potency, or you can do it with potency and frequency if you really wanted to. But you see what I'm saying? That if strep X is creating all the signs and symptoms that somebody with scarlet fever is going to exhibit, and belladonna in the proving created exactly the same set of signs and symptoms, or so close it's not funny, Now what we have is that the resonance of the two individual substances, strep and belladonna, must be close to each other. And so therefore, now you apply the natural law of similars repelling, and that's how it works.
Okay, but that's great, and that's that really traditional acute repellent model. What about the replenishment model, the chronic or the constitutional? Because, you're giving the scarlet fever as an example. It's really clear cut, and it's, it was Hahnemann's bread and butter. I think scarlet fever was his first big one that he really proved homeopathy with. And I mean proved it.
Well, he wrote an entire book on the treatment of scarlet fever with belladonna.
Yeah, he proved it to an audience, not approving, but proving to his audience. But you get like the diagnosis. A lot of these chronic states have diagnostic terms. And I mean, pandas is a very familiar one to you. But the reality is even though there's commonality to the presentation, there's lots of individuality. This is not like scarlet fever. This is a whole different ballgame. Can you even begin to explain the difference?
Yeah, when you start getting into constitutional treatment, you're no longer... Well, like I said last week, the remedies themselves are adaptogenic. So they're going to not only be the energy that is needed, but they're going to choose the method of application that is the most suitable to the patient. So if the patient's vital force says, okay, we're under extreme attack here, we need to repel this out of the body, like with scarlet fever, then it's going to adopt a repulsion model. However, if the body is chronically drained of energy, then it's going to automatically make the decision to go into the replenishment mode, right? So, and this is why, like, again, we spoke last week about Clark and all of those follow-on remedies, the chronic of the acute remedies, meaning that the acute didn't do the full job. All that the acute did was a bit like an antibiotic. It doesn't kill the bacteria or the infection in the same way as an antibiotic will do, but what it has done is that it's repelled it or it's pushed it from the system.
But the patient's left depleted, still having other symptoms, often their own personal chronic symptoms
That's
are
right.
flaring, and now you're going into a whole different state. I guess the problem, and I'm trying to resolve this in my own mind, is that if someone's needed belladonna for an acute and it's helped them get through the acute, which is fantastic, they didn't die, they got past it, it helped alleviate the symptoms. Now they're in this depleted chronic state. They're depleted because they've been through that fever or whatever, but it's not necessarily so that the remedy that's now chosen for the chronic has any relationship to that acute remedy that was given for the acute, even though their chronic state is worse because of the acute. Does that make sense?
Yeah.
I'm trying to say it in a way that I feel like it's quite confusing for a lot of homeopaths, and myself included. I'm not confused now. When a case comes to me, I know exactly where I have to go with it. I understand it, but actually explaining it is quite tricky.
All right, the easiest way of knowing whether or not you're dealing with acute or a chronic case is just the longevity of the symptoms, right? So
it's kind of anything over 7 or 8 days, and you're rolling into chronic.
Well, what the definition of an acute is that you were fine yesterday and now you're not fine today.
Yeah.
Right? So what's the difference in reference to symptoms? And that sum total of that difference is what you repetize on. But what you're generally repetizing on is the impact of the virus itself. Now, once the virus is gone, now what can happen is that you are you start going back into your normal state, and all of those old signs and symptoms start to return again.
And the word normal implies repetition, something you're familiar with because it's happened over and over and over, which is your chronic problem or your constitutional problem. There might be an overlay of a label, pandas, or you're an arthritic person or you're a migraine sufferer or whatever, and that's a label, but and there's a truth to the label. It does describe a sort of commonality of symptoms, but it's not helpful for the practitioner to think like that when they're choosing their remedy. They need to almost separate their head out of the pathology to form the treatment.
And certainly if you're dealing with chronic, absolutely.
Yeah, and I think that's where, the labelling is... it's good. Obviously, people like to get a label and go, I'm suffering with X and, I've been diagnosed with X and X is what I've got, and do you treat X and how long will it take to get rid of X? But really, it's more about them suffering with X and how long is it going to take to rebuild them so that they're not suffering with X anymore. But you haven't treated X, you've treated them.
Yeah, no, that's right. And so when you're dealing with acute and chronic, another way that you can look at it is, am I trying to combat an infection, or am I trying to fight a disease, or am I trying to promote health?
Yeah.
Because there's two, they're not the same thing.
Yeah, and promoting health, it's a whole clear headspace, isn't it, where you're looking at the case, you're looking for all the weaknesses in the case, and the label, yes, it's there, it floats around, it matches the way the presentation of the symptoms is, but it's those weak areas you're trying to define, and you're trying to define how the body's fighting back in its own unique way, which is the generals, the modalities, and you need the totality of that expression and the miasm of the person via the face to even have a hope of starting to get a lock and key remedy.
Yeah, absolutely. So what we've got is that we if we go back to the scarlet fever, so we know that the belladonna got rid of it, and the person survived. So, and that's another definition of acute. It has a sudden onset and has a cessation period that is fairly defined, meaning that it doesn't go on for years, and it usually only goes on for
sort of a few weeks,
1 to 2 weeks.
Yeah,
usually. Sometimes some things can go on longer, and then there are some infections that create such a chronic response. I mean, tuberculosis or syphilis is an example
malaria,
of that.
Yeah.
But when we're dealing with most acute diseases, we're dealing with, especially in the modern age, still a little bit of measles around, not so much, but you're dealing with, colds, flus, COVIDs, all this sort of stuff. So you give a remedy which is specifically designed to be a genus epidemicus to that particular illness, but that's not the same as health promotion, so you can be left feeling pretty bereft and energy starved at the end of that acute, even though the remedy has helped you. So now this is why in the old books, when we were talking about, say, Clark, for example, Clark's dictionary talks about chronics or follows on remedies, constitutional remedies to acutes like belladonna. But now but that's matching one remedy to the action of another remedy, and that's not what we do.
You see that you have to go from the first point to the second point, but there's no specific pathway between the two remedies. Like there might be for some people, but it's not something you should look at as a rule.
No, I don't think so. No.
Well, it can't be because the chance of the patient sitting in front of you being a tubercular patient and needing calc carb is statistically quite low.
Yeah, I know, and that's why I don't follow it. And like I said, I used to do it. I gave it a good go. I mean, when I was originally taught these things, I tried, but the whole reason why I moved away from it is from the, you know me, I'm a very pragmatic person. In the end, it either works or it does not, and it did not.
And I think a lot of other homeopaths have moved away from it too. I mean, these old ideas are just not commonly clinically applied anymore. Pretty much most homeopaths over the last 100 years have gone forward trying to find the elusive single remedy that kind of locks and keys with that person. And that's correct. I think, as we've discussed many times, it's just that they go via personality in a lot of cases, whereas you've found, excuse me, miasm and totality, particularly via generals, to be just nice and solid in the outcome and quicker to find.
So what we're dealing with now is that you've switched, or another way you can look at it is it's either disease or health promotion, or that's, which is just another way of saying acute or chronic, or you can look at it in the way of you're switching the focus from away from infection and towards the patient, or as Marjorie Blackie once wrote, the patient, not the illness.
It's the rebuilding. It's the focus on rebuilding health.
Now we need to know more about you. Now, a lot of homeopaths work that out, right? I mean, we need to now know about the patient. But now what they did is they went, tell me about yourself, right? Oh, I like bananas, and I like skiing, and I like this. That's got really nothing to do with it. That's what I've found out. That kind of personality profile means absolutely nothing. What I mean is that I still can't get enough energy because I'm waking up at 3 a.m. every morning, right? Modality number one, worst 3 a.m., or you can go into it, use it as a general, because all sleep is general. General meaning it affects the entire constitution, right? So when we talk about a generals, now this is where Kent was good, because he divides things up into mentals, generals, particulars, although I think it was done prior to Kent, but he emphasises this as well. So a general is and while I'm on Kent, if you read the introduction to Kent's repertory, you have a good understanding of where he was coming from. And it's great, by the way. So a general is something that affects the whole person, right? Not a part. So it's usually, often would be referred to as an I rather than a my, right? My toe hurts is a particular.
I am hot. I am cold.
I am hot. I am tired.
I am sweaty.
Yeah, they are all generals because it's you that sort of quote unquote you that's being affected. So I've lost my track now.
Well, you're just trying to differentiate the idea of the chronic remedy, the idea that it's about rebuilding you. And it comes from two places. It comes from the pattern of your symptoms, your generals, and the way your defense mechanism works, which is your miasmatic state.
Yeah. And so when you're looking at the sum total of modalities, sensations, and generals, which I know you know, the purists will say, well, they're all generals. And they are. That's true. I understand that. But, just for the sake of sort of breaking things down to make it easier to understand, what all of these generals are is that they are the sum total of particularly if you're doing worse for, what I mean, all modalities that are worse for 3 a.m. like we were talking about, or, that same person can't, they can't digest meat, or they're sweet, so worse for eating meat, or maybe any food makes them feel worse, so therefore better for fasting, worse after eating, stuff like these. All these modalities all form a picture that is a profile of the strengths and the weaknesses of the patient that's in front of you. And now what I do is that the sum total of those strengths and weaknesses tell me a group of remedies that are going to have a resonance that the body is able to use now in a replenishment model, right? So in order to build them up and in order to promote health this time. But in order to do that, you also need to know what type of vital force they have, because you not only need the sum total of these, you also need to have the direction that the vital force works in.
And that's our 7 miasms. This is the most important part, these 7 directions, or the 3 primary directions: outward, circular, inward, or the combination, or of 2 of each, or 3.
Yeah.
Everybody has
so
that.
So why is that important in a replenishment model? It's because the patient that's in front of you is not doing it correctly. Do you see what I mean? Like,
what do you mean by doing it correctly?
Their energy, their vital force doesn't have enough energy to be able to bring them back to a state of balance by itself.
So they're just hanging in there. They're still alive, they're functional, but they're not feeling great and they're not really improving.
No. And if their vital force could do it naturally,
it would.
Then it would have already done it, and then you don't need us. But you need a type of energy, which is the miasmatic group. But now you need to tell this sort of very tired and brain-fogged vital force where you want it to go.
Yeah.
Which is the sum total of the symptoms that they're showing.
Yeah. So you're giving them self-energy, because in a funny way, that's the weird thing about chronic illnesses. It is your body's best attempt at making itself better, but it's clearly failing. But it doesn't feel like a best attempt when you're the one experiencing the symptoms. It feels like it's failing. Like the failure of it is paramount in the patient's mind, right? Even though at some level it's doing its very best.
Yeah, it's doing its best, and sometimes it doesn't seem that way, because what it's doing is that it's assessing the strengths and weaknesses of your body, and it's sort of going, okay, look, the skin may not be a viable option here because it's just not working all that well, so we're going to go through the lungs because it might be a bit more expedient and they're in a healthier state. So now all of a sudden, this is this traditional sort of, okay, you've suppressed a skin eruption, now it's coming out onto the skin. But
via the lungs.
Via the lungs, but because it's the next organ of elimination. But the vital force might choose that naturally anyway.
Yeah, yeah. It's interesting though, isn't it, the concept of what being sick's all about, that in fact, the way you look at it is there's an element there that it's trying. It's like the survival instinct itself. Well, it is the survival instinct, of course, operational at a body, emotional, mind level, but its whole purpose is to do what works to survive. Do you feel that that's linked strongly to every symptom that you're experiencing? Or, I might be going off track there, but I feel like it's the same pattern.
It'll do it to a point. Yeah. Like when the less modalities that you're giving me, because you just don't have them,
you haven't noticed.
You're not trying to be recalcitrant, right? But let's just say that we're the 4th or so consultation in. So I've spoken about the need for it, but you just don't have them. All you've got is pain, and all you've got is physical symptoms. The less individualized symptoms you have, the more difficult it's going to be for me. And the deeper that I know the pathology is in you. So I have to start changing my expectations.
Yeah.
All right. So if someone comes to me and the pathology is mild and there are a number of modalities, I know I can get that case pretty quickly. When Hahnemann talks about matching it up, symptom totality, and we effect a perfect cure, I think he writes in the organon. Now that can be achieved. to a point,
Yeah.
right? And it's going to depend on how deep the pathology is. And that makes sense in a way, because if your vital force was really strong, it wouldn't have reached that depth in the first place.
Sure.
So the very fact that your pathology is deep is showing it's showing your ability to be able to withstand the stresses of life as they present themselves. And I'm not talking about a congenital or a hereditary condition here. I'm talking about an otherwise healthy person who had a healthy childhood, who had a healthy teenage years, who had a healthy early adulthood, now gets into middle-aged and things are all falling to bits. Mm-hmm. And by falling to bits, I mean, I don't mean I'm forgetting where the car keys are, or I think I need glasses because, I've been on the computer too long. I'm talking about arthritis, rheumatoid arthritis, cancer diagnoses, all serious labelled chronic disease.
Yeah.
So something is going on where you've got an outside stressor and you've got the body's attempt to keep it at bay of which it's losing. Yeah. Otherwise, you wouldn't have the pathology in the first place.
Pathology is a sign of failure.
Yeah. So now, can you reverse that pathology? Can you get that perfect cure, end quote, that Hahnemann was talking about? It depends on the stage. Mm-hmm. It depends on the stage, and it depends on the circumstances of which a person finds themselves
and to some degree the age too. I mean, the older you are,
that's a circumstance, right?
Yeah.
You just don't have the same vitality at 60, 70, 80 or 90 as you do at 20, 30 or even 40.
Yeah.
You just don't have it. So the healing capacity is less. Also, too, there could be circumstances that you just can't change. It may not even just be the remedy itself. There might be circumstances like a disabled child, a violent partner. You might have been with a gambler. You've lost your house, all your savings, all this. Just this immense stress that's on you, and you just wonder how on earth you're going to get it back. No, it doesn't affect you right then. It takes time. But, this is why when someone comes to me and they've just got a diagnosis, let's pretend they come to me with a serious diagnosis in 2024, the very first thing that I ask is, when did you start noticing the symptoms? Usually they don't come to an alternative practitioner straight away. They're not like you and I, hun. They usually try conventional means first. So the first time that I started experiencing these symptoms, usually in a milder form, of course, because one of the differences between chronic disease and acute is that the acute has a limited time frame and peters itself out, and the longer you go on, the better you recover. Whereas with a chronic disease, the longer it goes on, the more serious it becomes.
Yeah. Mm-hmm.
Right. So I first noticed this chronic disease in 2019, 5 years ago. Mm-hmm. So my very next question is going to be, just tell me a little about the circumstances in your life around about 2017, maybe 2016 onwards. What's happening?
It's usually sort of 2 to 3 years prior.
Because there's a drain somewhere. Mm-hmm. And I know that there's a drain. When I'm in a drain, I'm in an energy drain. Mm. There's a plug that's been pulled out in this person's vital force. Mm-hmm. And I need to understand where all this misappropriated energy is draining from. Yeah. I need to find... I'm like that old sort of little Dutch boy. I'm looking for the hole in the dike to stick the finger in, to stop it from whatever,
Draining away.
Yeah, draining away.
Leaking, yeah.
So that's what we're looking at. And sure enough, there's always a story.
Yeah.
An otherwise healthy person that is now not a healthy person.
There's always a cause.
Always is a cause. There is always a biography to match the biology. Always.
And don't you think that I mean, I'd love to talk more about people's biographies. I think it's fascinating. And not that it's always why you choose the particular remedy, but I just find it really fascinating, these repeating patterns, and also the fact that when something happens to people that's stressful, you know, just sweeping it to one side and I'll be right you probably won't be given time. You know, it's probably a good idea to start tackling and coming up with a fresh perspective, a fresh energy source, a change in the way you're living earlier on than waiting, don't you think?
Yeah, absolutely. And look, the stresses of life, can I deal with it? Well, if you're talking to me, then the answer is no.
Otherwise, you wouldn't be in the clinic.
No, you haven't handled it. You've handled it the best you can.
Yeah, but there's residue.
And here's the other thing to understand. There's memory and then there's muscle memory.
Yeah.
Right? Your vital force imprints. It succusses and I'm assuming people know what I mean by succussion, but maybe you can explain that in a minute.
Yeah.
But what the vital force does is that it succusses the stresses of the time onto itself, right? So it actually creates a new channel of flow, because the old channel's just been so blocked up that the life force, the water life force, needs to find another avenue, but it's not the one that it used to be. And the problem with that is that raging river is now turned into numerous streams, none of which have the same flow as that first, as the original river.
Yeah.
So your body is only getting streams. It's not getting the really full, strong flow of vital energy that it used to. And that blockage will have been imprinted onto the vital force of that patient by whatever ongoing stressor was occurring. By the time you've got pathology, the bottom line is this. Pathology is showing you that the vital force is losing.
Yeah.
That whatever, you might be coping as well as you can, but you're not coping.
Yeah.
Right?
Well, clearly you're not coping. And some people obviously do cope. They have a memory of a particular event that was highly stressful and they didn't get sick after it. They were okay. They made it through, but a lot of people don't. Succussion, you asked me this before. I feel like I'm a student here having to answer a question. But essentially, you're looking at a situation where in the homeopathic model, you're taking a substance, say you're taking a particular flower, let's just say it's pulsatilla, and you are dissolving aspects of that plant into a water and an alcohol base. So you're, creating a herbal tincture of that plant. Then you take a drop of that herbal tincture and you put it into 99 drops if you're doing the C centesimal scale, or 9 drops plus 1 equals 10 equals the decimal, but let's go with the centesimal. It's the one we use most of the time. So 99 plus 1, and so that's instantly diluted, and that dilution you would expect would dilute its impact. But Hahnemann worked out that if you rapid shake that liquid, it seems to imprint the memory of the one drop onto all the other 99 drops, and now they're all imprinted with the memory. Then he took a drop and did it again, and that's from 1C to 2C, and then again, and then again. And so when we get to a 30C, it's happened 30 times. So not only has it been diluted 1 in 100 essentially, 30 times, but it's also been imprinted each time. So the memory's still there, and it's fascinating because it can't be seen under the microscope. This is why homeopathy gets scoffed at, because it can't be measured in that way. But there's an understanding across the pharmacies that is still in there. That that memory is still in there, not toxic anymore, but still a whole lot of communication and message about that plant can come through that 30C or maybe the 200C. It's been done 200 times, or the 1M, which is 1,000 times. So you can imagine the dilution effect, but also the imprint. And that's important, and it's often forgotten. There's a lot of focus on the dilution, like it's like a cup of coffee in the Pacific Ocean. It's kind of true, it is. But, it's been succussed over and over and over on each round. Every round it gets succussed, gets imprinted.
The other thing that's really important, you're absolutely right. You've explained it really well. But the other thing to add to that, because you hear it all the time, like you said, it's the same as adding a cup of coffee to the Pacific Ocean. I get that. I know what they're saying.
Literally, from a dilution point of view, it is.
But the Pacific Ocean isn't a small space.
Mm.
Right? I mean, what we were talking about last week when we were talking about this, when we were talking about the magnets. I mean, if you have two magnets and you put one at one end of the house and one at the other end of the house,
you're not going to notice.
They don't interact with each other.
So it's all about the small space, which is meaning within the bottle, within you. You are a small space.
You are a small space. Yeah. Your cells are a small space.
And you're contained. You're contained in your body. You have an aura around you and there's an energetic flow there, but you're essentially quite contained. And that's why the remedy seems to interact with you.
You're absolutely a sealed unit.
Yeah.
Absolutely a sealed unit. And when you talk about things like, all right, it contains an energy of vibrance, but people within a scientific community will turn around and say, well, there's no proof of that and that's all rubbish. But, imagine you're doing a psychological experiment and I show you a number of images, but you just decide you're not going to tell me what you're experiencing and you're going to remain completely poker-faced. How do I know what, if anything, you're experiencing? Now, the reality is I don't, right? But does that mean you're not experiencing it? No, it doesn't. That doesn't mean that at all.
That's a point of view, yeah.
Right? So we know that these things occur in the same way as we know that we have different emotions, because we physically express them, right? So when you're doing homeopathy, we understand that vital force, as we call it, but you can call it anything if you wanted to, but just for the sake of understanding what we're talking about, you have to come up with common terminology. Otherwise, we're all adrift at sea and we can't communicate.
Yeah.
So that vital force shows itself in the same way as emotions show other people that you're having them, by physical expression.
Yeah.
And we can give remedies to people and they have physical expression, good, bad or otherwise. But they do have that physical expression showing you that energetic change is taking place, in just the same way as a person smiles when you tell them a joke or you say hello.
Yeah.
Right? So that they're, anyway, I won't go on with it, but that's essentially what it's about.
Yeah. No, really interesting. That's probably a nice place to end. Right. And, I'm not sure where we're going next week, but it'll be interesting to see, because I feel like you brought up some different ways of looking at energy then that are nice to think about.
Well, write down whatever you want. I mean, I don't know where we're going next week. Well, the only thing you can be assured of is that I will put no research into it whatsoever.
Okay, well, that's good to know.
All right, okay. And on that lazy note, I'm going to say good night.
Okay then, see you, Grant.
All right, bye everyone.
Thanks for listening to Soul and Survival. If you are interested in more information, books, courses, consultations, learning more about facial analysis or life themes, please visit our college site, Victorian College of Classical Homeopathy, vcch.org.